Hello, where are others?
Don't know, sir.
What happened to them? Actually, the user ID and password is same for the Zoom video. It is same. Yes, the compose. I forgot to send the Zoom ID actually. No, every day it will be same that this thing Zoom ID and passcode.
Okay, sir.
Okay, you you have got that particular message in the what you call as the in WhatsApp. You have got the message.
No, sir.
Good, so then I sent it through WhatsApp. OPQRS T OPQRS. So yesterday we have dealt about the drugs, especially which are having the action on the blocking agents, especially the muscarinic and nicotinic cholinergic receptor blockers, the naturally occurring agent, as well as the synthetic agents, and many agents which can be used in the many disorders of the human beings. And today we will know the drugs acting on autonomic ganglia. What is an autonomic ganglia? It's a junction between the what do you call as the pre and post synaptic nerve terminals and a special neuron type or the junction. So here the autonomic ganglia, the acetylcholine is the primary excitatory neurotransmitter in both sympathetic and parasympathetic ganglia in all type of the in the entire body. The neurotransmitter which is excitatory in nature in sympathetic and parasympathetic ganglia is acetylcholine. That's very well known. And drugs especially which inhibit the synthesis of the acetylcholine, that's the hemicolinum, or release of the acetylcholine, which is inhibited by the botulinum toxin and also the local anesthetic, that is the procaine, and they can interfere with the ganglionic transmission, but drugs which act on cholinergic receptors in the ganglia are more sensitive, especially to the action of the acetylcholine in the ganglia. Then so this is also the acetylcholine is going to act on the postsynaptic receptors in the autonomic ganglia and going to excite it. So in addition to the dominant nicotinic type of the NN, means neuronal type of the nicotinic receptor action, this mediates the preliminary rapid depolarization of ganglionic cells, and there are subsidiary muscarinic M1, M2, adrenergic, dopaminergic, amino acid and peptidergic receptors. So here, apart from this acting on the NN type of the receptor, the acetylcholine in the ganglia is going to act on the many other cells which are present on the postganglionic cells, like the receptor like muscarinic M1 type of receptors and M2, adrenergic receptors, maybe many alpha and beta type, dopaminergic, dopamine 1 and 2, and the GABA and glycine receptor. They are called as the amino acid and the peptidergic receptor, like adenosine triphosphate, ATP and other receptors are also it is going to act. That's why you cannot expect the acetylcholine act on only on the what do you call as the nicotinic type of the receptor. These bring about the secondary, slowly developing but longer lasting changes in the membrane potential. That's the both positive and negative, because there are on the postganglionic membrane there will be either inhibitory or excitatory receptors. So what we can get the action is either it may be positive or negative, and we have to take the summation of every action, and the separate catecholamine like the noradrenaline and dopamine, and also the amino acid transmitters containing cells are present in ganglia, but peptides are released from preganglionic cholinergic terminals themselves. See, these many type of the peptide attackoids, or many times they are going to release and they are going to act apart from that of the noradrenaline and dopamine. Thus, this autonomic ganglia is it is not mediated by only one transmitter, one cell junction, but it's a very complex system capable of local adjustments at the level of the excitability. So, on the postganglionic neuronal fibers, so the many type of the receptors are present, starting from the NN and the M1, M2, adrenergic, dopaminergic, and apart from this thing, especially in the CNS system, the GABA and glutamate, etc. receptors are also present, and the many times such action, so you cannot say simply expect the action based on one receptor. It is a action related by multiple receptor subtypes. And now let us see what's a ganglionic stimulant. Ganglionic stimulants are the one which are going to stimulate the ganglia, and here we have got two types of the stimulant. One is selective nicotinic agonists and non-selective, and they are also muscarinic agonists. And in case of selective nicotinic agonists, the classical example is the nicotine in small doses, whereas the lovelin is also from the Nicotina lovelia. And another drug example is dimethylphenylpiperazinium, or it's also short formed as DMPP. And another thing is the tetramethylammonium, or the TMA, and another drug, that's the varenicline, is the another drug, whereas the non-selective muscarinic agonists, the examples are the acetylcholine, carbachol, pilocarpine, pilocarpine, anticholinesterase agents. And another drug is MCN 343A. MCN 343A is another drug. So please remember that the examples of the selective nicotinic agonists are the nicotine in small dose, lobeline, dimethylphenylpiperazinium, then the tetramethyl ammonium, and varenicline. And also the non-selective muscarinic agonists, please see the acetylcholine is also a non-selective one. Apart from this one, the carbamyl choline chloride, carbachol, and the blocking agent, the pilocarpine, and many anticholinesterase MCN343A are the example. Please remember the classical examples of the each category. And coming to the class, the very special class, that's the principal occurred in tobacco, that's the Nicotiana tabacum. So you know what's a tobacco? It's the principal alkaloid. It's a very characteristic alkaloid. It's the tobacco. Nicotine is present in tobacco and acts as the agonist on both NN and NM subtype of the nicotinic cholinergic receptor, NM and NN type of the receptors, especially the NRs means nicotinic cholinergic receptors. So sympathetic as well as parasympathetic ganglia are stimulated, but larger doses cause the persistent depolarization and ganglionic blockade. So the nicotine is important, what you call as the context of smoking tobacco or tobacco chewing. So you know it very well that the persons who consume the tobacco or tobacco products will have the nicotine effect, and it's only a clinical indication in short-term nicotine replacement in tobacco abstinent subjects. So especially the nicotine is important in the treatment of the person who have got addiction to the tobacco use, and nicotine replacement in tobacco use is also another useful clinical significance. And apart from this, then there is no therapeutic application of the ganglionic stimulants, and because no useful purpose can be served by stimulating both sympathetic and parasympathetic ganglia concurrently, because in the ganglia there are varieties of the ganglia are there in which there are both type of the receptors are there. Then N and M, nicotinic and muscarinic, and also the adrenergic receptors. So totally all the system is so at a time it is stimulated, hence such action is not warranted. Hence there is no therapeutic application of the ganglionic stimulants. And this is an important thing, a social menace, especially the smoking. Smoking is a social menace, and nowadays everywhere you can see that no smoking boards. And tobacco is dangerous to the health. Such taglines are there, and another thing is the quitting. The tobacco chewing is also a major effort, especially in the entire world is concerned. And majority of the smokers and tobacco chewers wish to quit smoking and chewing but fail to do so because of the nicotinic dependence. It is not in their hand, and many times the